Welcome, everyone, to the 5th Annual Luminos Fund Unga Week Symposium. I'm Caitlin Barron. When I founded Luminos in 2016, it was with the expressed mission to help the last 1 in 10 children in the world who are still denied the chance to go to primary school to get a second chance to learn. And yet, at the height of the pandemic, 9 out of 10 children around the world were out of school. In so many different ways, our world in the education space has literally been turned upside down. And in this moment, it is powerful for us to look to countries and nations that have historically led in education to guide us on leading our way back from this moment. And so it was in this spirit that my colleagues and I dove into deepening our understanding and appreciation of the Ghanaian education sector this year. And it is my great pleasure and privilege to have a wonderful panel with us today to actually take us through that. So those of you who've had the pleasure of working in Ghana will know that it is both a nation of 30 million people, one of the fastest growing economies on the continent, and at the same time often feels more like a village in the sense that everyone seems to sort of know each other already and have all sorts of long-standing connections reaching back through time. And so in the spirit of that village, I am going to keep introductions brief today and really give us a chance to dive quickly into the conversation. Taking you around the screen for the moment, we have Yawa Hansen-Kwa, Executive Director of the Emerging Public Leaders. We have Patrick Awua, Founder and President of Ashesi University. We have Karina Gardner, Executive Director of the IDP Foundation. We have Dr. Kwame Akyeampong, Professor at Open University, Director of the Center for the Study of Global Development, and a longtime evaluator and friend of Luminos. And the group of us are gathered in discussion and reflection around a powerful new piece of research from Dr. Kojo Abreh of the Center for Global Development and the Institute for Educational Planning and Administration. And Dr. Abreh and his colleagues have really pulled together a powerful dipstick of where is Ghana today in terms of reacting to and coming back from the COVID pandemic. What does this mean for the education landscape as we see it now and into the future? And so without further ado, Mike, I'm going to turn the floor to you. Can you help us get this conversation started?
It's my pleasure to be here to present to you impact of COVID-19 in Ghana's education sector, a study that we've been working on with Center for Global Development and IEPA. Indeed, we have a consortium, some working in Senegal, in Malawi, and a couple of other countries in a back-to-school efforts. In today's presentation, I bring you 4 different items on my menu. In the first case, very context for this study in the form of the motivation for this study. Beyond that one, we will move ahead to give you a sense of the data collection methods as well as the procedures we used. This was kind of interwoven into the whole presentation, and then focus will then be on what really we found at the household level. We went into this study with a strength, and the strength is that we are generating evidence from household rather than from schools. And the final thing probably want to give you is to give you some headshots in terms of schools and EC specific updates available. So beginning from the motivation, we could see around March 15, 2020, when the coronavirus issue became kind of hard across the globe, Ghana took a decision at a fairly young stage when we had just recorded barely some 10 and a few number of cases. And it was that rapid. But journeying along what's happened up to June, probably through July, down to October, probably jump to January, there was a skyrocket from January down to somewhere around February thereabout. That there is something happening that may not give confidence to people to go back to school. that became a source of worry for us. And for us, we were interested in taking a deep dive into really things happening in Ghana that could promote about issues around access and equitable provision of education, and indeed offering social justice to many who wouldn't be served in terms of emergencies and in terms of troubles of the pandemic's nature. Thus, we recognize the specific dates these things occur in Ghana. And in March, on 9th to 22nd March, we took a step to go to the field to do some in-person study, to create a panel, and at the same time to generate household level evidence in terms of what confidence households had in preparing their kids to go to school, and how much kids have gone back to school, and a few things around the school closures as observed. Next slide, please. In doing this, we felt having a good coverage of the country was a good piece of thing that was going to occur. Indeed, to make sure that our dimension of things, especially around equity and provision of social justice, becomes a central concern. So we went throughout the entire country, and as you know Ghana very well, as where we are really urban areas, much as we are peri-urban, as well as rural areas. And so the spread of how much we went, intensity of how many people were concentrated at places, is a definition of how households are structured within the enumeration areas as provided. And so we entered about 3,700 households, and we did visit schools, 484 schools, as well as 372 early childhood centers. Next slide, please. So household survey results. So when we went to the household, we brought some two major findings in terms of what dynamics we observe from the standpoint of the households. The first one we want to flag is dropout rates fairly remain similar to what we knew before. And indeed, our reference point here is that of multiple indicator cluster survey undertaken in the year 2018. And you could see to my left, the blue, the bars, the blue, the gray bars and all that indicates from grade 1 through grade 6, junior high school and senior high school, the dynamics of dropouts. But you can see some yellow line overlaying the graph. That is the movement of the multiple indicator cluster survey. Largely, there seems not to be too wide a gap in terms of the dynamics of how dropouts had been before and when we conducted our survey in the March 2021. But let's take it to the transition group. In terms of transition, again, we don't see so marginal a thing occurring there. But let's now move down to the right-hand side. We make the case that repetition rates might have doubled. We are able to make this case because what we hear from households, when we overlay the multiple indicator cluster survey results in terms of repetition in Ghana on it, we kind of see something there is again that there was no dropouts. And to the right, you are seeing something that gives a cause of worry. Next slide. So what does this really mean? Typically in the measurement of efficiency and effectiveness measures, as well as providing social justice, one central concern is to find out how those who are marginalized, those who are deep down there, how they are affected. So let's see the storyline in terms of the disaggregates. When we put this data in terms of the disaggregates, and especially using wealth quintiles, we realize that those in the poorest household apparently happen to be on the more disadvantaged side. But the bigger disadvantage going for boys than girls for most cases, apart from the richest quintiles where we have just very little difference between male and female, where the female outnumbered the number of males in terms of dropouts. In terms of rural urban, we still see the disadvantage to rural, and in terms of private and public, the disadvantage is to the public. But going to the right-hand side, the issue about rural urban, we still realize that repetition is an acute situation in the case of the rural population compared to the urban population. But here again, the storyline prevails that males are more disadvantaged in terms of repetition compared to females. What do all this mean to us? Probably the next slide still helps. All this means something in terms of the bigger picture of why people go to school and why people should learn. That takes us to an issue around why parents feel there has been a learning loss or not. When we ask households whether they feel there has been learning loss, we understood from about 85% of households that they feel their kids have lost some learning. How much learning they've lost, we cannot quantify because this is a household survey and we do not have the expertise in household to give us that. But probably let's do a bit of disaggregate again. In terms of the three zones we had, the coastal zone, the forest zone B, the middle zone, as well as the savanna zone, we realized that savanna zone, which has more of kind of rural communities, really disadvantaged compared to their colleagues in the coastal and the forest zone. In terms of web quintiles, we again see that the learning loss we observe from the parents based on their feedback, we realize that mitigation of learning loss was an issue that happened wealthier households compared to households that were not wealthy. And in terms of location, again, as you see, urban areas had put in more intervention to support learning than rural areas. But you may ask, what kind of intervention are we talking about? Probably the next slide will give us an indication about the kind of things that they said they did. And the saddest thing is that about 3/3 of households in the rural side of things were actually disadvantaged compared to their urban folks. In terms of really what they drill down in terms of approaches, we realized that step study, parental tutoring, private tutoring was in the equation, and we could see that largely most households implemented self-study only. But that's not a key thing we want to take up in this discussion. In terms of times of emergency, we want the kind of education that spread to the majority of people. And a key look at what we have here, the 4. Indeed, we found dozens of other things, but these are the 4 major ones. Radio, TV, online, which happened to the most prolific opportunity to spread education to entire nation. We realized that it's in the limbo. Apart from the richest quintiles families that had opportunity to use this avenue for education, that is not the story to be said about the other kind of disadvantaged households, as it were. Indeed, giving us a cause for worry, because poorer households and rural households rely heavily on self-study exclusively. And in the period of emergency, information needs to be translated to a number of people in different ways. One major way is radio and all that, which is given us for the next slide. So in terms of all we talked about, we needed to be sure in terms of resources how schools were doing. Social distancing in classroom, mask, thermometer, as gun being available in schools, as well as frequent hand washing. Both households and schools were able to tell us that this was occurring in their places. And to that end, they indicated that you could see from the school, in terms of the heads of schools situation, that they have so much confidence in availability of masks and mask wearing, as well as thermometer guns and all that. They were not too confident, indeed, for both household and schools, in terms of social distancing in classroom, how this was occurring. We asked our enumerators on the site, on the field, to examine whether these things really existed. And they were able to confirm that, yes, the social distancing thing was occurring to some degree, but mask, thermometer availability, thermometer gun availability were all there. But Availability of Veronica buckets was also mentioned, which was largely to about 100%. As to whether it had water and the water was being used and there was soap and it was being used, those ones do not come into the picture for now. But the key things are, it flagged very important issues of equity in resource provision, allocation, and management in schools. Next slide. Beyond logistics, we also talked about policies and their implementation. And as you can see on your slide, you realize that most schools indicated they kept students and parents informed about measures implemented and ensured collaboration in the process. They promoted school-led initiative, and this is very much in terms of completely to moderately agree, a very profuse thing that occurred. And those who provided information on COVID-19 prevention guidelines also mentioned this. And indeed, across teachers and students, we see that kind of it's almost about the same story about what they've received in all these guidelines. The next slide gives us a bit of highlights in terms of the flagship issues we got at the school level. Because every effort of our household is to make sure schooling occurs. In terms of household, we see to the left that a number of things, 74% provided teachers and other staff with relevant information, 47% kept students and parents informed about their measures they implemented to ensure their collaboration and support. And in terms of early childhood and household survey results, we could see about 53% of households being affected by the fact that early childhood center closures occurred. And so they are domiciling cut back on work. They did, some were laid off and some had to get reduced wage and some even lost their wages as well. 58% of households who had early childhood kids had challenges in paying staff times of school closures. And indeed, 43% of early childhood centers face challenges in enrolling new children in the centers. These plus other activities were issues that occurred. Next slides. So what does all this bring to the picture? If dropouts and repetition from the literature tells us that these are indication or suggestion for wastage. If this were the case, what we saw in Ghana, which we can call a good hold of issues around dropout and repetition becoming a concern, does it give indication to scholars and everybody to come on board in terms of this? Location, wealth, and zone disparity will be a definitely concerning one to any person who matter about education and schooling. Perception management is one of the surest ways to support in times of emergency. Issues is how is this being harnessed in household level? Disparity in recovery of lost learning approaches, as well as how this is managed, mean a lot. At the heart of all this equation is the issue of equity and social justice. And in periods of resilience and progress making in emergencies, no one will want to leave anything behind in making sure that there is full recovery in terms of participation in education. Therefore, if we did this within 1 month of school reopening and we found this, if we hold on resources, policies to see how it's looking like, and if we are able to share all these through the medium we are using, we are only sure that if you journey along with us in phases 2 and 3, we may have more compelling stories to tell, and you will be also aided with the opportunity to interrogate data and make your support available. Thank you.
Dr. Abreh, thank you so much for that wonderful orientation to the current state of play on the ground. And I think some of the things that really stand out to me in your research are the number of unexpected dimensions of disadvantage, right? I think when we face a crisis like this, we go sort of looking in usual suspects for who is the most worst off. And what's fascinating, of course, when you turn to actual data, is that there's all sorts of unexpected findings there. In general, children coming back to school, which is amazing, and actually, quite frankly, better than we hoped. At the same time, even from day one, we're seeing that repetition increase. And of course, as we know, the legacy of learning loss is likely to actually amplify repetition over time. And again, the dimensions between rural and urban, I think this is always the greatest dimension of inequity in any country we operate in, but it's the one that's easiest to forget about. And when we see data like yours, it just brings us a fresh focus and a new understanding. And I'm just conscious of what an extraordinary moment this has been for civil service leaders across the health and education sector. And of course, thinking in particular of the Ministry of Education, what it's meant to be a minister in this time, what it's meant to be a rising civil service leader. And I'm so thrilled that we have Yawa here with us on the panel, because of course, Emerging Public Leaders has been deeply engaged in just that question of civil service leadership for some time. And Yawa, I wonder if you can just share with us a bit of a sense, sort of, what has it been like to be a rising bureaucrat in the government system in Ghana in the last 18 months?
Well, Caitlin, thank you for the question and the opportunity to be on the panel. Dr. Abreh, thank you for these great statistics. I was encouraged to see that there wasn't as high of a dropout rate and that young people are continuing to be in school here. But I am hearing from the fellows, the public service fellows that our organization has placed across 14 different government agencies here in Ghana, and 3 of whom work at the Ministry of Education. And it has been an overwhelming time to kind of troubleshoot what this moment means and how to meet the moment with the right strategies for how education gets delivered. I think the crisis of COVID forced all of us to adopt new technologies. And I was glad to see the ministry champion new initiatives like the Learning TV. I had my daughter watching a few of those episodes on TV. And I think, we are pleased that we are somewhat at the forefront of what's happening through our fellows. 3 of our fellows work with the Inspectorate Directorate in the Ministry of Education and have had the opportunity to help kind of supervise the work of some of the institutions of primary institutions as well as secondary, and to make sure the quality of what they're delivering is still there. I think as well, education and what happens in this space is important to the kind of jobs and careers that young people have the opportunity to take up. And we are recruiting the top and the best, recent university graduates and placing them in these civil service roles. And I think a big thing for us in this moment is to make sure that we're what's happening in the education space is really adequately preparing people for those future jobs, and particularly those public service jobs of the future. How do you innovate for a population that is changing so quickly? How do you ensure that the way children are learning today will meet the needs, not just of the present, but of the future? And I'm passionate about this because the training we're providing our fellows is helping them troubleshoot that in the ministries and agencies that they're in. We have this simple focus that if we get bright young people in the mix at this early stage, they can help troubleshoot and bring on new ideas and innovations that will really set Ghana on the right track, not just for this moment, but for the moments to come.
A brilliant introduction of both the challenge and the promise of this moment. And I just want to offer up to our large audience for this call, invite everyone to be adding their questions to the Q&A now. I'll do some work here engaging our different panelists, but I know we're really looking forward to engaging the broader conversation as well. And so if I can invite folks to feel free to add your questions to the Q&A function, and we really look forward to weaving some of those into the conversation. So Patrick, Yawa was talking about education for the 21st century and beyond. One of the, I think, sort of enduring conversations in higher education for the last 20 years has been the sort of faith that technology would at some point change everything. And yet for years and years and years, actually very, very little changed. And the way people went to university looked and felt fairly similar to the way I went to university a long, long time ago. Suddenly, though, that future we've been waiting for is actually here. And what has this moment meant for Ashesi? And I wonder if you have any sort of broader reflections on higher education in Ghana in general.
Yeah, you're absolutely right. There's been this ongoing conversation about online learning versus in-person learning. A few years ago, Ashesi made a strategic decision to become cloud first in all our systems. And so we had started to deploy a lot of cloud systems. We were just starting to engage them when this crisis hit. And what we found was we were able to switch to a completely online model within 2 weeks after the closures. This is very different than what we've been doing for the last, say, 5 years, where we were doing flipped classrooms, where we were sort of merging technology and in-person, to being in a mode where we were completely online. But it also raised some profound questions for us. So one of the things that was really critical for us was that we wanted to make sure no one was left behind. This meant that we had to make sure that students, as they went home, had access to technology. So we had to make sure every student had a laptop. We had to make sure they had a data connection. We paid for that data connection. If they lived in an area where they didn't have access to data, we paid for them to move to another area, have another residence from which they could have access to technology. We also encountered this sort of difficult situation with some students who are living in very small homes, right? So imagine one room with 10 people living in it. Even if you have a laptop, you have a connection, you have a 4G connection. How do you do work? How do you actually take a class in that environment? All that commotion going around you. So we had to move some of those students as well to more conducive environments. And ultimately, last semester, we moved some of those students back to campus with all the support around them so they'd have a strong connection, because it turns out that even after we'd done all this work and they were all connected, we started to see some students' grades slipping. And that raised flags for us. And we realized that actually online was not perfect for everybody. So we've now come to a place where there's significant amount of work happening online, where we know how to do it well now. And I think that in the future, there's just going to be this hybrid model that we will do, not only with students, but even with the staff. We don't have to have everybody on campus all the time. The people can work quite successfully from home. So it's been a very interesting period for all of us.
And what's it been like to actually be able to bring students back together in larger gatherings?
We had our first town hall meeting. So this semester, all students are back on campus, and classes are happening in combination of online, hybrid, and in-person, depending on faculty preferences. But I was on campus yesterday, and students are absolutely thrilled to be back. They're thrilled to be back in touch with each other. The isolation that they felt working from home is gone. They're able to work more in groups. They're chomping at the bit to be able to start to do contact sport, and we're being careful about that. But it's a very good feeling on campus to have all the students back.
It's an extraordinary moment, isn't it? Right? The technology has both brought us radically new ways of engaging, educationally speaking, which I don't think any of us will easily let go of. And at the same time, this time of isolation has reminded us of how important in-person connection is. It's
right, but
sort of like we've been pulled in two directions. Yeah.
I should say students also recognize other advantages that online brought to us. So we now have far many more faculty, international faculty, who are teaching from North America at Ashesi, and students really appreciate that mix of faculty. And online has made it easier, and it's something that we're definitely going to keep as we move forward, that we will always have some classes now that will be taught by international faculty who may not need to travel to Ghana to teach those courses.
Mm-hmm. No, that's just great. Well, one of Ghanaian education sector is known for a number of things. Of course, it's known for Ashesi and the innovation in the higher ed dimension, and also equally known for being one of the countries and ministries of education that was a really early adopter in embracing the non-state sector alongside the state sector. So working fairly collaboratively and openly with locally private schools. And I imagine in part due to that sort of visionary leadership, there's quite a robust non-state school sector in Ghana. What we know across the world, however, was that the time of school closure was especially devastating for non-state schools. And Karina, I wonder if you can share a bit about IDP's reflections on the last year and a half.
Yeah, thank you so much, Caitlin. I think it's been an incredibly interesting year to see both how this unexpected pandemic has given sort of some of the biggest blows that we could ever imagine, especially to affordable non-state schools who are running on very limited to no cash reserves. We're serving a population who are also hit really hard by COVID. And so we're among the first populations to really struggle with their employment and with their own income, and therefore the ability to pay even the lowest fees, was impossible. And then during closures, all income was stopped altogether. And so this was a really, really tough time. However, it's been really interesting for us to see how sort of the same things that attracted IDP Foundation to supporting affordable non-state schools in the first place is also what has pulled them out of COVID and made them more resilient. IDP Foundation is a small family foundation, and the majority of the schools that are affordable non-state schools are small family-run businesses that are organically built up, and they're responding to a need in the community. They're responding to communities that are underserved or out of reach of public schools. And they are driven by a lot of determination, and often while they're small interventions, their impact is really big. Around the world, the affordable non-state school sector is growing rapidly. It is growing rapidly because the demand for it is growing rapidly. And in Ghana specifically, it's about a third of schools and a third of the population, depending on which segment you're looking at, roughly are being educated in affordable non-state schools. Their independence makes them strong and passionate, but it also can be a downside. It makes them a little bit invisible from the overall sector, and sometimes they're forgotten when we look at the overall education system. And so, we saw some of the, from a government perspective, we saw some brilliant response in terms of including all of the non-state schools in their PPE and fumigation responses and getting masks and Veronica buckets out. But on the downside, these schools were almost completely left out of any stimulus or financial aid that was coming from the government, partially because there's just not been a real clear official way to include them in the systems. And so they didn't qualify often because of different paperwork and because there's not sort of that commitment to registration and regulation, which is something that we'd like to see a lot more of. At this point, because of what a huge part they play, if they were to collapse, what that would do if we weren't able to see at least 90% of the schools, as we did see, actually able to reopen, partially because of emergency grants that we helped give and unusual support, the overall pressure that would put on the total education system would just be horrible and also not something that they could really recover from. I think as a funder and watching what happened with COVID over the past 18 months, while a lot of foundations understandably diverted funds into health and into emergency response around responding to COVID specifically, we really felt that this was a time to double down on education, that education as a sector is really feeling the blow, and that we actually are seeing globally, aid and national budgets having to divert in order to respond to COVID, which means financing for education is really under pressure. Which is why now more than ever, a model that doesn't rely on government funding or on foreign aid, but actually is being financed through small business owners, through community and family-run businesses and parents who are paying for it, and has a financial sustainability. And as we're now seeing, a real amazing resilience is actually more important than ever. And we're really hoping that this brings the importance of the whole non-state sector to the overall education system to light, and that it can be more incorporated into the overall solutions that we're looking at.
Fantastic. It's a wonderful story of bouncing back. I think if we were having this conversation 9 months ago, we'd have a really different outlook on the non-state sector than we do today, which is extraordinary. Dr. Akyeampong, I don't want to miss the chance not to bring you in here. And in particular, one of the many sort of examples that Ghana has set across the continent, educationally speaking, has been in particular on the focus of our mission, which is bringing a second chance at education to children who've been kept out of school. Ghana is known for having created a very much a homegrown approach to bringing children back up to grade level and helping them get back to school, and then indeed having nationalized and institutionalized that effort, and really offers a roadmap to so many other countries in this particular moment. I know Dr. Akyeampong has spent a good deal of time studying both our work in Ethiopia, but also the journey in Ghana, and it's been a really enriching back and forth conversation for us at Luminos. And I'd love, Kwame, just to invite you in here to share a little bit about like sort of what are the implications of this moment for the work of bringing out of school children back into the system.
Thank you very much, Caitlin, and thank you, Mike, for your presentation. I think the picture that your presentation paints, it's quite familiar in many other countries, and to an extent to be expected. But what I think was striking for me was the fact that the dropout rate had not increased, rather you had repetition. But we know very well from the research is that repetition is the precursor for dropout. So even though you don't have high dropout, or the dropout has kind of stayed stable, COVID has really raised the stakes when it comes to dropout, because if we have more repetition, we are more likely to have dropout in the future. So I think this is a signal for us to really pay attention to those who are in school, because they risk being dropping out as we move forward. I think one of the things to say is that Ghana has been very successful, as in many other African countries, to improve access to education. And that success is being seriously hit by COVID. But I want to also add that much as we are concerned about the impact of COVID, we have to look at systems of things that we've done that can point a way forward in terms of addressing the challenges that we are going to face. Unfortunately, there's been quite a number of research that suggests that we have ways in which we can address this. And I'll just mention two and highlight three priorities we should attend to. First of all, in research that we've done recently ourselves with the University of Cambridge, we found that looking at out-of-school children in Ghana, we found that after they had completed an intensive program of which for about 10 months to close the learning achievement gap, that many of them were able to be placed successfully in public schools. And they were able to achieve at levels that were similar to those who are already in school. Now, that's a very important indication that children who are out of school are not lost to the system. We can actually do something about that. So it is possible that the learning needs of children who have dropped out of school can be addressed, and this can provide a way back into public school education. But we also found in that research that to achieve this, mother tongue instruction and participatory pedagogy are key things. And what Ghana's story tells us is that the talent pool is not to be found only in those who are in school. I think we put a lot of emphasis on children who are in school. We try to make sure, and we have children who have come back as a result of COVID, but many who are out of school are equally capable and can contribute to Ghana's development. Some exceptionally talented and promising children have dropped out, either because of poverty, poor quality, or early education, or lack of access to a school. So one of the reasons we have found in our research is many of the children drop out and repeat, as Bright's presentation has shown, because the teachers are not able to teach at the right level of the child and in a language that they can understand. And in the early years, that is crucial, getting children to understand what they are learning. So we know that a combination of teaching above their level in a language they find difficult to understand and ineffective pedagogical approaches, for me, is the recipe that produces dropout and repetition. And that's something we have to look out for as we move forward. So what are the three priorities that I would like to list as we reflect on what is happening and how we move forward? I think we have to have a policy of leaving no out-of-school child behind. I think we often talk about leaving no child behind, but really we need to put an emphasis on leaving no out-of-school child behind. We should expand and intensify complementary basic education programs for out-of-school children, wherever they may be found. We need to believe that every child can learn, and that if they are not doing so, it is not because they are not doing it is because we are not doing a good job or a better job at meeting their learning needs. It is our responsibility to respond to that need, and that's very important. I think the second thing is we need to strengthen our school community relations. There's often the thinking that the communities, the parents, the households, the caregivers are not interested in education, particularly when we talk to people in the rural areas. That could not be much further from the truth. We should actually involve them. They have a better understanding of their circumstances to help us to chart a way forward, especially during this period. We should not impose solutions to them without having them part of the dialogue to understand how this will impact them. I think we do that at our own peril, and this would be to the disadvantage of the children. And finally, from what we've learned from our research in Ethiopia, but also some of the work that we've done in Ghana, that it's very, very important that we introduce culturally appropriate participatory pedagogy that is based on the mother tongue instruction. It's just so important that right in the early stages, these children have good access to education through language that they can understand. And we have piloted approaches that we know work. So I think that as we move forward, the solutions are there. It is up to us to really embrace them and take responsibility for engaging with what we know works and ensuring that children can actually learn. And I think that if we did that, we would be able to address some of the challenges that are coming ahead. I think what Bright has painted is just the tip of the iceberg. The cumulative effect of children being out of school is going to be felt much later on. And if we don't respond quickly now to some of the things that have been mentioned and also I've mentioned, I think that this will live with us for a very long time. But the good news is that we have solutions and we have the research evidence to back it. Thank you very much.
Oh, I think it's a wonderful whirlwind tour of exactly the challenge and the opportunity of this moment. And it has never been more clear that if we are to reach the most vulnerable, we have to be mobilizing communities. Those are the folks who are on the front lines, and they have to be a part of the answer, part of the outreach. I mean, I'm also struck by your refocusing around the importance of instruction in mother tongue. And I think about in this moment with children, especially the most vulnerable children, doing self-study, learning remotely. Imagine layering on top of that the difficulty of them doing so in a language other than their own language, right? So even when parents themselves may not be fully literate, if their children are learning to read in the language they speak, parents can be an enabler, supporter of the learning process. As soon as we layer that further distancing between home and school on top of the learning equation, we just make it that much harder to manage remote learning. So It's a wonderful rundown. We've had a rich set of questions coming in from the Q&A, and I won't be able to get to all of them, but I do want to make sure we get to some, and I'm going to be terribly biased because my friend George King from Liberia is weighing in with the question, so he goes first, which is just a question about kind of, this was a question to Dr. Abreh, but honestly, I think Patrick and others could equally weigh in on it. Sort of, what are you seeing and understanding right now about practice today in the classroom for preventing COVID transmission? And I think you had some great data, Mike, in your research, but I just wonder, from the classroom observation standpoint, from what your researchers have seen on the ground, like, what are you seeing as the current state of practice? And I think Patrick might actually have more frequent kind of week-on-week testing data just in terms of transmission in the classroom. I'd love to just get some thoughts on kind of like, what is the lived experience of trying to prevent COVID transmission in Ghanaian classrooms right now?
Yeah, I think that's a very good one. I think all our effort will get wasted if the policies, the resources that have been supplied do not get used. But the international literature does say that use is a function of what we have as benchmarks. And so in preparation for school to return in the United States of America, the focus was how CDC prepared the protocols for schools to be in school, windows being open and all that were issues of protocol. Now, in terms of our study, we had a focus, and our focus was largely examining in terms of resources and in policy and its implementation, how schools were being prepared by the Ghanaian people to make schools be hosted for host the kids, especially so that there was rising cases of COVID around January, February, and there were parents having their doubts whether things would be successful. And so our focus was kind of directional, what resources were available. But if we want to pick up on the CDC's way of things, then what this would have meant was for us to have a set of stringent protocol outlined and establishing how schools, teachers, as it were, educational workers, learners, parents were complying. If they drop off their kids at school, what protocols do they follow? And if kids get to school during break time, how do they follow protocols? Much as there's not such stringent, and comprehensive, even if there is, and comprehensive kind of benchmark outline, it becomes difficult to do. And indeed, because this was not a focus of our study, we didn't deep dive into that. But our focus was twofold: to examine state of resources available, and to find out how policy and its implementation was occurring in schools.
So I'll share just a few thoughts on this, and I'll focus on sort of the boarding environment, so campus environment. With the secondary schools, the protocols around wearing masks, washing hands, having ventilated classrooms were all in place. But it's also the case that with the boarding schools, once students arrived, they were not allowed to go back home, nor were they allowed to receive visitors. So they created a bubble, right, in the school. And last semester, when we had 200 of our students on campus, we adopted that model. So we had students come in over a period of 3 days, and we would test. If they tested positive, they were put in isolation. And we created this bubble. Students were not allowed to go back and forth from campus. They were not allowed to go out on midterm breaks and all of that. And then we were very careful about the staff that did come in, to, cafeteria staff and so on, making sure that they were screened appropriately. So we ended up creating a bubble of all negative cases last semester. This semester is a little different because this semester we are allowing students to leave campus, not to stay more than 24 hours away from campus before they return. All the other protocols around social distancing, hand washing, ventilated classrooms, we're not using air conditioning, for example, are in place. And we've layered on top of that testing every 2 weeks. And as people test positive, they are put in isolation. So we have a dormitory that is reserved for isolation. And then they're tested on a regular schedule. As they test negative, they're led back into the population. So this semester is a little different, but we're proceeding as cautiously as we can without being as restrictive as we were last semester.
It's extraordinary to hear how you've responded to this moment, and amazing that operations have been as smooth as they have.
Right, and wear a mask as soon as you step out of your dorm room. So the dorm room is your bubble where you don't wear a mask, but as soon as students leave their dorm rooms, they have to be in masks. And so that's how we're navigating.
Oh, wonderful. And I have a question here from Bettina Behrens of the Bosch Foundation for Dr. Akyeampong and Dr. Abreh. Just a question on what advice would you give to schools today, looking at the repetition rates such as they are and anticipating a sort of cumulative backlog of learning loss going forward? What, if you were a principal in this moment, how would you be responding today and into the future?
Okay, no, thank you. That's a very, very good, important question. I think that just before I say something on that, I think that COVID has also taught us that schools cannot operate in a bubble. They operate in community and society. And we need to engage. You know, if a child is not going to come to school because they feel that school is not safe, the parent, the parent would withhold the child. So I think this research has shown that that's very important. But I think schools should have early warning signals. I mean, we have done research in the past which suggests that you can actually detect a child who is at risk of dropping out by looking at the level of participation over time. So we should have early warning signals that if you have a child not attending regularly, that must be a signal that there's something going on. And often we don't engage with that. What we do is the schools sit there as receptors and just wait for the children to come in. I think schools have to be proactive to say, well, who are the children who are at risk of dropping out? Let's get into the community. Let's engage with the community and find out what is the challenge that they face. And if we do that, I think we would reduce this incidence of dropout seriously. I don't think we have genuinely engaged with poor rural communities. We have treated them as if they are not very responsive to what is being offered. But we know, demand and supply go together. So we do need to do that. And I would encourage schools to engage much more with the communities in which they find themselves and have systems in place that can detect children who are not attending regularly and begin to engage with their households to be able to find out what the problems are and address them immediately. Thank you.
Probably just to add something brief to that, the concern about managing wastages, which we talked about regarding repetition and dropouts, is a very rife concern, and especially seen through the lens of equity provision, we realize that there is need for us to have a good database of what kids' backgrounds are. Without that level of leverage, it is difficult to be able to have a good thinking on what can be done to support people. The trust of everybody working around social justice is to bring those down the app so that there's that level of leverage, equity provision. If technology can be available, then we need a good data that tells us how much of Ghanaians listen to radio, how much of Ghanaians, if we want to use television as a mode of communicating, how many Ghanaians have television, and beyond how many Ghanaians have television, how many harness the use of television as a mode of communication. So stuff like that, we need very robust database to do that. But more practical things to manage this are varied across contexts. And even within Ghana, there could be several ways of managing some of them. And like Professor Akyeampong said earlier on, the issue around managing the concern about repetition. We know in Ghana, schools were fully, all kids were promoted. There was mass promotion among basic schools and all that. But look at the story we are getting. So it looks as if we need more data that we have now to appreciate and understand the dynamics of the various category of out of school children and kind of incidences of dropout, the shades it takes and all that, to be able to know which interventions are forward-looking and more development.
Caitlin, if I may, I don't think we can overemphasize the importance of kind of the public sector organizations that oversee the education sector. So I think as much as I'm hearing the recommendations, we can't overlook the fact that many of the schools in every country across Africa, Ghana is not excluded, are overseen, by the state. So I think a critical piece to this education conversation is, how do we influence who's making these decisions, who's enacting these policies that are governing the way our children learn. And that's why I still, want to raise the flag about the importance of, the civil service institutions and the people that work in them. And we're finding through our work that if you can work within the system and build cases and bring in talented and eager people to innovate and kind of hack out some new solutions, it solves many of these problems that we're raising. So I want to continue to kind of draw the linkages there, because I do think that there could be an untapped way of approaching some of these solutions as well.
On the question of repetition, I think that it's an opportunity for actually helping kids achieve mastery. And, I have an example, an emeritus professor of Ishesi who set up a low-cost private school in his home village. It was a high school, and he found that students who came to this school couldn't speak English. They couldn't navigate English, which is what the exam was going to be taught in. The numeracy skills were not where they needed to be. And what he did in his school in the first year was actually have them repeat a lot of material from primary school and junior high school. And today, the kids from this school are all passing the national exam with strong grades, with credit. They're all qualifying to go on to university. And so I think the approach, the lens through which we look at repetition and what we're trying to achieve makes a huge difference in what the end result is. I don't think we should necessarily look at repetition as a precursor to dropout. We should look at it as an opportunity to actually achieve mastery of skill before they move on. And Dr. Abreh's data shows that the repetition rate has increased from, it looks like approximately 4% to 8%. 8% is significant, but it is manageable. And even at 8% or 10%, we should be able to have those students get the skills that they need to move on and not drop out.
Patrick, I couldn't agree more with your point on mastery. And for us at Luminos, the work that we do is often described as accelerated learning. But I always say that what's important about it is not that it's fast, but that it's deep. And that by going deep in foundational literacy and numeracy, we set children up for a lifetime of learning. And I think that principle of mastery has got to hold for all of us in this moment. Speed is not as important as depth. Well, this has been such a wonderful whirlwind tour, and I love that we have a big group with us today who can actually get a sense of exactly how robust, dynamic, and innovative the education conversation is in Ghana today. And I think you can all understand that it's easy to get excited about having the chance to be a part of this community. And so I wanted to take just a moment before we close today to share the exciting news that Luminos is in fact jumping into the Ghanaian swimming pool, and we'll be launching a program in Ghana in 2022. And we are, as of today, searching for our first country director. So I'd like to enlist each and every one of you on the call to help us be a part of really setting up with success. But we could not be more grateful for the thought partners, advisors, and idea generators who we've had the chance to connect with over the last 6 months and then here in this conversation today. And so without further ado, Karina, Kwame, Mike, Patrick, Yawa, it has been our great pleasure to have you with us here today. Thank you so much, and go well.
Thank you.
Thank you.
Thank you very much for having us.
Yeah.
Bye.
Bye.
Bye.